Well, one of the congressmen who's on the committee which will first consider this bill is Republican Buddy Carter. He's from Georgia. I spoke to him a short time ago. Congressman Carter, congratulations. You've now released the Republicans' health care plan, but there seems to be a hitch, which is that lots of Republicans don't actually like it. You've got a string of conservative think tanks. They say it's no good. You've got members of your own caucus, your own Republican study committee, and Senator Mike Lee, who's a Republican, who says this is exactly the kind of backroom dealing that we criticize Democrats for. How are you ever going to get this passed?
Well, keep in mind, our whole goal was to present something that is more accessible, more affordable, and that's patient-centered. I'm really happy with the plan that we have there. Are there parts of it that I would have liked to see? Maybe we could have gone further? Sure, that's always going to be the case. But overall, I think the plan offers us the opportunity to have affordable, accessible, and patient-centered health care.
Right, but you can't be thrilled with the amount of opposition to it from within your own party. We haven't even got to Democrats yet.
Well, we never expected to have any cooperation from Democrats either anyway, so that's beside the point. But, yeah, there are those in our party who are concerned, and we're going to mark up this bill in committee, and we're going to see if there are things that we can improve upon. If not, then we're certainly going to put forth the best bill that we can for the American people. Look, we've got to do something. Obamacare is failing. It is collapsing. This is something we very well could have just set it around and just let it collapse on its own. But we decided to do the responsible thing. We decided to be proactive and to go in and help and to fix the health care system. And this is what we're trying to do here. We're trying to bring the free market back into the health care system.
Okay, Obamacare, now Trump care. And that means that the Republican Party owns America's health care system. Politically, that's not without hurdles for you, not without potential dangers.
And that's okay. Look, the most important thing here is to make sure that we repair the health care system that has been destroyed by Obamacare. That's the most important thing. Yeah, we're taking risk. We understand that. And that's part of our responsibility is to take risk. But what we're trying...
Congressman, destroyed by Obamacare, 22 million people now have insurance who didn't, and Obamacare is polling more popular than it ever has done.
Look what is happening. I can't understand how you can look at what happened just this weekend in Tennessee, where you have 16 counties that don't have a carrier whatsoever. You have 5 states in our country that have one insurance carrier there. That's not competition. That's not what's going to bring down health care costs. That's not what's going to give people choices.
Congressman, let me sort of go global on this, because this seems to be the quandary that repeated American administrations try to fix and just don't manage to. Other Western countries have healthcare systems that cost a lot less and prove to be a lot more popular than the American one. Why is this so difficult for the United States to get right?
Well, it's not difficult. I would submit to you that we have the greatest health care system in this world. There's nowhere else you want to be in this world if you're sick than in the American health care system.
If you
but
have
it needs to be
insurance.
affordable, it needs to be accessible, and it needs to be patient-centered. The worst thing that Obamacare did was to put barriers between the patients and the medical professionals. And that's what we've got to make sure that we do, is to make it more competitive, make it more patient-centered. If you look at our plan, you'll see that we're increasing health savings accounts, that we're giving tax credits to people in order to buy insurance. We want to make sure that people have control over their health care. Our approach from Washington, D.C. that says, hey, we know best, and we're going to tell you what you need to be doing with your health care. Health care is very personal. People want to have control over their health care.
Okay. No one likes Washington, D.C. Buddy Carter, thank you very much for joining me.
Thank you.